Hi there, YouTube. Welcome back. I am back. This is Rachel, the nurse, and we are having, is it right? Burger King today. Okay. Let me open this so y'all can see this nice, juicy burger. I'm gonna eat some, and then I'm gonna get into the story time. And of course, y'all know some little tips. Look at there. Bacon. Let's see. Bacon. Look at that. Nice, y'all. Maybe I get a good thumbnail doing that, y'all. So, let me eat some. This is not showing, so we ain't gonna worry about that. I gotta, I have to erase some of my videos too, I think. Mm. Okay, I'm gonna eat some of my burger, and then I got some little tips for you guys. Some news topics. Oh, look like this table is close to me. Mm. I'm gonna try. Mm. So, how you guys been doing out there? Mm. Mm-mm-mm. Mm. That's good. Let me get this paper towel here, y'all. So, what I'm gonna do is try to read this stuff in order for y'all. Mm. Feel good. I'm all the way down. Y'all can't even see my shirt. I'm like this. But I do have a shirt on. So, I got my little notepad here. Remember when I told you guys, notepad. So what I'm gonna try to do is I got this last ending from, well, from the book, and I'm gonna read it because I didn't want to write all of that down. So I'm gonna read like what I wrote down in order for you guys, and then I'll read this little important little message that can be helpful too with signs and symptoms. So, vital signs. We want to look for vital signs, y'all. You know, you can do the best you can. You have to look for signs and symptoms so that way you know who you need to take vital signs for. So, what I have written down here. I have vital signs. Signs and symptoms to report to your supervisors. This is the signs and symptoms that give you guys ideas of what you need to report, like offhand, so that way you won't go wrong in nursing. So, one, falls. Two, chest pains. Three, severe headaches, because that could be like a tumor on. So you want to report headaches because it can be real serious. Four, difficulty breathing. Of course, we know that you need to report that because, you know, some people, of course, needs a little TLC, tender loving care, if you guys don't know what that is. TLC is tender loving care. Some people needs a little bit more tender loving care. So, you have to know if they having difficulty breathing, okay? Five, abnormal pulse. That's very important to report abnormal pulse. So y'all keep that in mind that we need to report these pulse. A pulse does not supposed to be too rapid. A pulse does not supposed to be low, below 60. Okay, so that's very dangerous. So you want to keep that in mind. Um, well, it's abnormal pulse, respiration, and blood pressure. All of those things are very important to keep in mind to report. That's not in the normal range, and I will get to that too. I think I have like a little brief, and I will do other videos and kind of break it down to you guys of the abnormal um, ranges that you will look for. Okay, so we're gonna look for number 5 was abnormal pulse, respiration, and blood pressure. 6 is change in client's mental status. Sometimes, people may be angry about something. They may need someone to talk to. They have social workers that can talk to them and give them a better understanding. So every time you go in there to take vital signs, you always need to introduce yourself. Tell the patient, ask the patient their name. Sometimes they can be rude and be messy. I mean, real mean, rather. Some of them can be messy too. But if they're not having a good day, just say, well, I'll be back and I'll come back to you. Because you have a lot of other people to tend to. So you just go back and say, okay, I'm back. Are you better now? You know, Mr. You just say their name, call them by their last name, and you introduce yourself so that way they can be comfortable to talk to you and you let them know what you're doing. So that kind of helps with the mental status. 7, sudden weakness or loss of mobility. So you want to report that. 8, high fever. Yes, we have to report high fever. They can go in convulsion. It's a lot of things can happen. They can be having a very bad infection going through their bodies. So we want to report high fevers. 9, loss of consciousness. 10, bleeding. Of course, we want to report bleeding. You don't know. So, 11, change in client's conditions. Of course, you're with your client, you're with your patient, you see them every day, so you want to, report things that you see that's different compared to when you always see them every day. 12, bursts, ambitions, other signs of possible abuse. Bursts. No, births, aberrations, other signs of abuse, probably abuse, like when they get upset about something, they may need to talk to a social worker. Somebody might be abusing them at the convalescent. It might not be you. It could be another nurse. So they take their anger out. So you can't take things personal. Just kind of report it, let them be, and just do what you can for them, and just report the situation so that way they can have someone to talk to. And it might be different another day. It probably be totally different, believe me, when they get to talking to the social worker. So yes. Where am I? I'm trying to see where I'm at. I still got a lot here. Okay, vital signs. The vital signs consist of temperature, pulse, rate of respiration, and blood pressure. Those are the main vital signs that you're gonna really focus on and look for. Temperature, pulse, rate of respiration, and blood pressure. So now we have some special procedures. So we have to know the intake and the output of your patient. Of course, you give them food, so they intake. And you want to measure the output because some patients needs to be measured. It's a doctor's order, and they have to be measured because they have like inflammation, swelling, water is retaining, so they want the output, and that's very important, so that way they will know. Blood pressure is an important indicator of a person's health. I'm going to read that again. Blood pressure is an important indicator of a person's health. Respiration. The normal respiration rate for adults range from 12 to 20. I'm going to read this real quickly because I don't want to be like boring, making y'all bored. I just want to give y'all some good tips on, so that way if you want to go into nursing or home care, private, whatever, you can know these things and you won't go wrong, you won't be scared. So, normal range respiration rate for adults range from 12 to 20. Most of the time it's 20. If it's like below 20, then you need to report that. Indicate. Infant and children have a faster respiration. Infant breathe 30 to 40. So the infants, newborns, and children's, their respiration would be more faster than an adult because they more active, or they can be scared, so they breathe in more, and adults too, if they scared, they're not comfortable, they can breathe more faster. The pulse can be more faster. So infant breathes 30 to 40, adults breathe 12 to 20. And we'll get into that in another video for how you measure it with your secondhand watch and stuff. I'll bring a watch on here and then try to, kind of, measure it. That's when you got to do it manually. So these days they have machines, so make it more easy for you to do it real quickly. Pulse. Adults' normal pulse rate is 60 to 80. Okay, keep in mind, we don't want the pulse rate to go below 60. That's a problem. That's a big problem. Now, we don't want it to go 80 and above. That's a big problem. A pulse rate should not be 100 and more. And it should not be below 60. That's a big problem. Small children's is 100 to 120. They're very active, like I said. Newborn is 120 to 140. Okay? Theirs are very fast because newborns are their pulse rate, their heart rate is real fast. And that's normal. That's normal for an infant, a newborn. Okay, that was it that I wrote down, and I hope you guys got those tips. And I'm gonna read this brief little thing that I had got on my book. I didn't want to write this down, so I'll just read it off the paper here, y'all. This is heat and cold applications. Applying heat or cold to injured areas can have several beneficial effects. Heat tends to relieve pain and muscle tension, reduce swelling, elevates the temperature in the tissues, and increase blood flow. Increased blood flow brings more oxygen and nutrients to the tissues for healing. So keep that in mind, y'all. Always try to use cold, heat, cold, heat for pain, cold, hot temperature, you want to cool them down. You want to use cold compressions. And, and they saying here for some cold compressions you want to use too for some swelling. It all depends on what it is, the injury. So if it's an injury, you want to use the cold compression. It all depends on what the situation is. So that's what you have to use, cold and heat compressions. It all depends on the situation. Okay? Now, blood pressure. I'm going to just explain the brief thing with blood pressure. Because here it have the range here. When I read it, it have the range, and it's just really, you just listen closely, and it's kind of telling you what you look for its blood pressure. Very important. So, the systolic phase occurs when the heart is at work, contracting and pushing the blood from the left ventricles of the heart. The pressure reading you obtain reflects the pressure that is being exerted on the walls of the arteries. As the blood is pumped through the body, the normal range for the systolic blood pressure is 100 to 140. That is normal for systolic. So, the second measurement reflects the diastolic phase, which occurs when the heart relaxes. The diastolic measurement is always lower than the systolic. It's because the systolic is when the heart is at work, and the diastolic is when the heart is relaxed and at rest. So, relax. Okay, always lower than the systolic measurement and represent the pressure in the arteries when the heart is at rest. The measure, no, the normal, I thought that was measure. That's something there. The normal range for the adult is 60 to 90. So most of the time the diastolic is always low, and so that is the range, 60 to 90. You want it to be like 80, 70, 74, in that range. Okay? So y'all keep that in mind. And that's all the tips that I have for today. And I'm going to eat some more with you guys because I didn't read all of that stuff. So I hope that was very helpful to someone. You know, I can read it over and over again, so that way it's always helpful to me. You know, nursing, you're gonna always continue reading, so just get comfortable with it. You know, um, once you keep reading it all the time, you're gonna know the ranges automatically. So keep that in mind. And you can always Google it. The ranges stay the same. They never changes. So you just know that you want the systolic to be in the range of 120 to 140. And the diastolic is going to be like, 70, 80, 90. No more than 90. That's it. So I hope that was helpful to someone. And I appreciate you guys for listening. And thank you for coming if you watch this video. Next time, I gotta try to I gotta do homework. And so I have all this stuff ready and to present for you guys. Because I'm doing this video so late because I'm like trying to write everything down so I can present it in order for you guys. Because believe me, it will be in that order, the way you learn. You will know if you go into it. Look at the ketchup out of there. I'm getting full off of this. This is a big old burger. I didn't eat like almost half of it. It's too big. I can't eat all this. Yeah, I gotta be careful. I don't have these all the time. Because burgers can put some weight on you. It takes 24 hours for it to digest. Well, you guys, I'm gonna let you guys go. I'm gonna wrap this on up and eat it later or tomorrow sometime. But I know I want this burger though. It's good. I can never eat a whole burger. Unless it was one of those little bitty small ones. Real small. I can eat the whole thing. This too big. Mm, I'm full of good people. I really appreciate you guys for joining in with me with our little tips and study. I call it study. So it's been good that we had our little study hall today on some good tips. So y'all keep in mind, play the video back, rewind it back so you can see what I'm saying. I hope I didn't talk too fast for you guys. I think I talked really, really clear and loudly. I try to make it really where you can understand what I'm saying. So I really focus on that. But thank you for joining me. And I hope you guys come back for the next topic. I'm going to see what is going to be the next one. I was looking in the book. I felt like this was more important to present right now to you guys because that's very important for your loved ones. If you have your loved ones at home, you know what to look for. You know, you can get them to the hospital in time, get some help. You know, you won't feel alone like you by yourself. At least you know what to look for. And I'm so grateful to and thankful and honored to be here to even present and to even understand it and can let you guys understand it in what I'm reading in our own way. So, yeah. So it's more to come. I don't know what's gonna be the next topic that I'm gonna talk on. Um, Probably some personal care. I'll talk on personal care next video. Like for his mouth care, that's very important. Like some positions, positioning, because they got like a lot of people. They need a lot of nurses in subacute, so that's very important, and maybe that can be helpful. Positioning the patients. Of course, we want to make sure they have lots of water. Um, So yeah, that's what's gonna be the next topic on personal care. I'm gonna just grab a lot of tips that I can put together and explain it to you guys in my own way. And yeah, we can try to run with that. Um, on ways that I do personal care, and I'm gonna just write down like some little topics and you know reverse it in my own way of my experience in nursing with personal care. So that's gonna be the next topic. Like I had a video already saying that remember the basin is your best friend. So okay, you guys, I am gonna let you guys go. I didn't talk your ear off. I didn't read y'all a whole bunch to death. So, until we meet again, you guys stay safe out there and God bless you. Good night.